Next, pandemic disease X is a public health threat that could potentially spread rapidly and cause severe illness or death. The cause of the disease X is still unknown, though some researchers theorize that it may arise from a mutation of a previously known virus. Symptoms associated with the disease X include fever, chills, difficulty breathing, fatigue, and chest pain. It is expected that the disease X will be difficult to diagnose due to its novel nature, meaning that it could take some time to isolate and identify its cause. Treatment for the disease X is still unclear and would require further research to provide information on how to best manage an outbreak. Prevention of disease X includes isolating anyone who develops the symptoms, as well as wearing protective masks, washing hands and disinfecting surfaces. It is believed that vaccination with existing vaccines may be able to prevent disease X, although it is still too early to confirm if this is the case. Vaccines would need to be developed quickly in order to prevent a global outbreak of the disease X. There is also a risk that the illness could become resistant to existing treatments, leaving doctors and healthcare workers struggling to respond to the outbreak. Early diagnosis is critical in order to prevent the spread of the disease X, as well as having an effective plan in place for how to manage and contain it. Infection control protocols would need to be implemented, which involve isolating those infected, contact tracing, and implementing physical distancing measures. Research and development of medicines and vaccines should be a top priority in order to prepare for a potential outbreak of the disease X. Education and outreach programs would also be beneficial in order to inform people of the signs and symptoms of the disease X, and how to take the necessary precautions. Public health and political leaders should work together to ensure that the public is aware of the threat that disease X poses. Healthcare professionals must be trained in identifying and reporting the disease X to local and national authorities in order to improve the speed of diagnosis and treatment. International collaboration is essential to prevent an outbreak of the disease X, as it has the potential to spread quickly across borders. All countries should be prepared to share information and resources to manage an outbreak of the disease X. Additional resources and funding should be provided to organizations that can provide medical assistance and access to safe and effective treatments for those who become infected with the disease X. The World Health Organization should be actively monitoring the situation and sharing timely updates with the global community. Social media can also be used to spread information about the disease and the measures that can be taken to protect against it. Healthcare workers should be equipped with the necessary protective gear in order to ensure their safety while treating those affected by the disease X. Research should be ongoing in order to identify the cause of the virus and its potential mutations, and find ways to mitigate its effects should it become a global pandemic. Media coverage should be limited in order to avoid spreading fear and hysteria and focusing on the facts about the disease X. Governments should focus on providing accurate and reliable information, as well as taking the necessary steps to protect their citizens from the virus. Adequate resources and supplies should be stockpiled in order to ensure that treatments, such as vaccines, can be distributed in a timely manner if the disease X becomes pandemic.